All right. Can you see my presentation screen, my PowerPoint presentation, gentlemen? Yes, excellent. I'm after how many times of doing this, it's finally popped up, and I'm really quite impressed with myself. So there we go. Anyhow, as Steve had politely mentioned, my name is Lorrie Harrison, and I am a retired registered nurse. I live in Regina, Saskatchewan, and I retired in 2015, and my last position was clinical quality and professional practice. And William and I were kind of chatting beforehand, and that just means that I took good nurses and made them better nurses. And it was part of my job to improve standards of care and patient quality care as well. I also love to disclose some of the things that I am not attached to any form of big pharma or any companies or anything like that, but I am part of the Regina Prostate Cancer Support Board, and I'm also a member of the Canadian Prostate Cancer National Council, which means that I am the Saskatchewan representative on our Prostate Cancer National Council. So it's been a heck of a learning curve for me, and it's been really quite interesting work. And 2019, my husband was diagnosed with prostate cancer. And in November of 2019, he had a prostatectomy. So a lot of this is firsthand experience, and we are speaking from the heart when we talk about this. Now, tonight's presentation is erectile dysfunctions and solutions after prostate cancer treatments. And I put a prostate cancer treatments, and I'll discuss the different points as I get through it. Okay, now, some of the reasons or some of the areas that get damaged, especially after a prostatectomy or radiation, and it can vary with prostate cancer. If you've had a prostatectomy, it'll be pretty well immediate that after the surgery, you will have some form of damage. Now, this damage can happen as nerve damage, smooth muscular damage, or vascular, or the blood flow to the penis and to the pelvic region. So those are the three types that I want you to keep in the back of your mind. Now, also with fellows, and I'm going to move my thing so I can see it here. There we go. I'm just busy. Oh, it doesn't want to move. Anyhow, in regards to the pelvic floor, and this is why it's so very important for men to understand, is after a prostatectomy, and if you see where my cursor is, that is your prostate right in there, that little blue bulb. And that blue bulb is about the size of a walnut. And your urethra goes through that, and there's pelvic floor muscles. Now, this area down here is part of your pelvic floor, and you also have another sphincter, a bladder sphincter, that's right at the neck of the bladder and going into the prostate. So that's very important for men to understand, because men are the only, men are blessed with two sphincters. Women only have one. Now, over here is all the pelvic floor muscles, and I want you to be aware of the fact that there are oodles and oodles of pelvic floor muscles. So it's very important after you've had prostate cancer and after you've had a prostatectomy or radiation that it does and may affect all of those muscle groups. So that's why it's so important that you understand these bases. Oh, I'm going to introduce my husband. He just came on board here. So he's not wet anymore. I was. Oh, sorry. Okay, there we go. And this is my husband, Boyd, and he's going to help, and he's kind of cueing in on our presentation.
Anyway, before I start, apologies for being late, but I had to get the water turned back on the house. So.
I already showed him my hair.
Okay.
Yeah.
All right. Yes. Yes.
Anyhow, now the second part that I want you to be aware of, gentlemen, is the anatomy and the nerve structures. And this is also part of the three areas that can be damaged after you have had a prostatectomy or radiation. And if you notice here, this is, I got to look at this here. All these little intertwining things are all the nerves in around, and the prostate is back and through here. So if you're, and this is like the penile material, or the penis or whatever. Over here again, now there is some major nerve bundles here that go into the cavernosa, and I will show you another demonstration of cavernosa, and that's a nerve bundle and a nerve bundle over here. So please kind of keep that in the back of your mind when we go through some of the surgical techniques. Now, another thing, after prostatectomy and after a radiation therapy, your doc may start recommending penile rehabilitation. And I'm going to let Boyd talk about this in about a minute, or in a few seconds here, but in some studies, it's kind of mixed reactions. Is penile rehabilitation, is it necessary? And some studies say yes, and some studies say, well, we don't know. And, and some say, well, we just need to do more studies. So I look at it in this fashion, that each person is an individual. Please do not generalize yourself as my friend down the block, he had this, and this worked for him, but, oh, sorry, honey, but the same thing for him will work for me, not necessarily so. So that's why I always recommend you always have these discussions with your doctor or your healthcare team to help you work through these issues. Honey, do you want to talk about penile rehabilitation?
Can everybody hear me okay?
Yeah.
Okay, good. Yeah, so further, Lorrie, there, that's where one of the things for the erectile dysfunction is the pump, and that's one of the advantages of using the pump for the rehabilitation side of it. So it's just to get the blood flowing back into the penis again, which I'm hoping your doctor explained all that to you. But
we will.
Yeah,
we will. And part of the rehabilitation too is, like you said, it's all individual, and it depends upon what you and your doctor and your partner discuss and what plans you have for yourselves. Okay, now one thing for Boyd, and this is something that my husband found that was really quite helpful. It also helped with it was more or less the urinary, and to help the leakage and the incontinence, was pelvic floor muscle training. Now, they call it Kegels, and I call them power Kegels. And it's something, like with prostate cancer or prostatectomy, that you just can't have any therapist do. You need a specialized therapist that is trained in male pelvic floor exercises. You cannot have a female or not a female, a therapist that's just trained in females. The male, as I pointed out earlier, you have different anatomy, and you have to be aware and cognizant of the different muscles and the structure and everything out in the pelvic floor. So please remember that and bear that in, when we discuss this. The other thing I want you to be aware of is for the physiotherapist to get a good understanding, if you're doing your Kegel exercises properly, they will do a digital exam or a digital as you're doing your Kegels, just to make sure that you're tightening the right muscles and the right fashion. Because we have had fellows here in Saskatchewan and Regina that were not doing their exercises correctly. They were either tensing them up too much and creating more pain and more discomfort, or not tightening up the correct muscles in the right sequence. So it's very important to be aware of doing them properly. Now, I know we have some programs in place throughout Canada that do it online, and I want you to be aware. I like it, the in-person touch. I like that personally because it helps guide you a little bit better. And I'll let Boyd talk about his experience with pelvic floor muscle training.
Well, in the pre-assessment for the surgery, I met with a physiotherapist, and he showed me a few exercises to start doing pre-operatively. So I did them for 2 weeks prior to the surgery. And then I think it was about 3 months after surgery that I started going to get actual physiotherapy here in Regina. And there's only, I think at that time, there's 4 or 5 physiotherapists that did male pelvic floor therapy. So for me, I had 5 sessions, and then I continued on, and it helped me a lot. So I think it's very important that you need to start prior to surgery, and then again follow up afterwards.
And this is something too in radiation therapy that you may want to start looking at or wanting to do as well. Okay, now this does not apply in Boyd's case or my case, and I'm not very familiar with the oral medications, but we've all heard the medications that they have in regards to ED or erectile dysfunction. And I'm not going to, sit on this too long, but it's meant to help boost the blood flow. But also at times they've also mentioned that it's also neurological or the nerves. So remember, it depends upon what surgical procedure you had, and if you have a lot of nerve damage, but sometimes the oral medication will help with the nerve flow as well, or the nerves as well. Mostly for the blood flow, because it helps to increase the blood flow to the cavernous and the penis, which helps elevate or helps the penis perform. Now, these are the medications, and you may recognize them. Of course, we have the famous little blue pill, Mr. Viagra. These ones I'm not familiar with. Cialis I'm familiar with, and Anadafil. I know the Anadafil, but I'm not familiar with its generic name there. Okay, now these are some of the oral medications and some of the side effects that you may get with them. Is they say skin reddening. You may have a headache. Now that's because it's increasing blood flow. And also they say with a headache, if someone is on nitrates or nitrate medication for their heart, they do not recommend the use of these pills as well. So you have to be aware of that. Upset stomach, of course, vision changes and sensitivity to light and blurring vision and stuffy nose because it's increasing the blood flow. And pain in your back, probably your lower back or your lower tailbone section. Or kidneys as well, pardon me. Now, this is what Boyd was referring to as yes, Steve.
Just a question, if you're experiencing any of these symptoms, should you be contacting, should you go to emergency? What should you do?
I would say actually any of those symptoms, Steve, contact your doc as well, or your nearest healthcare professional that you have. If you're blessed and you have something like a nurse practitioner, or here in Saskatchewan, what we have is we have our nurse navigators with our prostate assessment clinic that work so diligently and so closely with our fellows here in from the Saskatoon office. So yes, it's very important to contact your doc ASAP or the team.
But there again, it's supposed to be something if it's really sudden and quite severe. That's something you should go to the emerge or. Do you have urgent care centers there or just emergencies?
Just emergencies. There's no specialty prostate clinic I'm aware of.
Okay.
Definitely not. That sounds like a very cool idea, though. I didn't realize that existed.
Yeah.
Yeah. Okay. Maybe I can ask you about that after, sort of thing.
Sure. Okay, we can talk about that further.
Yeah.
Now I know Boyd can talk firsthand with the penis pump, and there is a protocol that the doctors or the doctors here in Saskatchewan will do with their penile rehabilitation, and the penis pump is part of that. It helps increase the blood flow. I've got several different pictures here to kind of demonstrate. Of course, simple, straightforward. This is how it applies over the penis. And the next one, this is something that they say, like with
the use of the penis pump, you may experience these symptoms. With the treatment, it may be a hand or powered or battery pumped, and it just meant to fill the blood in the cavernosa. And I have an excellent picture that I can show you in a minute. Thank you, William. Excellent. Okay.
Hey, while we're talking about the pumps here, though, make sure you get a good one. Get one, a medical grade. There's two different companies. I think one is Osborne, and I can't remember the other one. But talk to your doctor. That's where I got the recommendation for which kind of pump, because you have to go to your neighborhood sex store. I'm sure you're not going to get the best quality. So they're expensive. I think the one I got was over $400, but depending upon your income and your situation, you may be able to claim on if you have any private insurance or income tax, that sort of thing. So.
Yeah. And with this pump, they have a recommended use for the rehabilitation, and they say 2 to 5 times a week for 5 to 10 minutes. Okay. Now, these are the side effects that you may have with the pump. The side effects is, well, I'm looking at the top part. Petechiae, which is small little blood vessels that break, and that'll probably be in the glands of the penis or the very end. And it's like little ruptured blood vessels. The temperature and the color differences caused by the constriction of the band. Now, there is like a rubber band that slips over the base of the penis to keep the blood into the cavernosa. And I know Boyd and I both, well, you noticed that it felt kind of cold. It felt like rubber. It didn't feel right. I know your person.
Well, if you've never used one, the idea is that there's a constrictor ring that slips on the base of the penis to maintain the erection if you want to use it that way. And for us, I just found it was cold because, of course, there's less blood flow, really fresh blood going into the penis. So I for the rehabilitation, it was okay, but for me personally, I didn't like the ring constrictor idea. So
yeah.
But there again, you have to experiment, and it's all individual.
And
sorry, just Boyd, if I understand correctly, I guess it would have been like the sensation was very different.
yes.
That's
it's kind of like a numbness, sort of.
Right. Okay.
Yeah. And like I don't know. To me, it felt kind of rubbery. Like it was really bizarre. So
yeah.
Okay. All right.
Yeah.
But to each your own. It's got to be what that fellow or that person's comfort level is, and also with the couple and yourself. It's got to be your comfort level. Mm-hmm. And if it's just something that doesn't suit your fancy, then so be it. The other thing that some of the side effects or problems that people face with it is pain and bruising. And of course, petechiae is a form of bruising. They say pain during sexual release or ejaculation. So that would be in the circumstance of a man that has not had a prostatectomy. They may be in after a radiation. So that's something. And they also say a feeling of unreleased semen. So I've got to be straightforward with you. I cannot speak first person, or I don't think Boyd can speak first person in regards to that one.
I think it's just called blue balls.
Oh, heaven's sakes, you. Yoy. Okay. Anyhow, another form of treatment is intraurethral or urethral pellet or muse. And we'll kind of discuss this really briefly too. With this is another form of penile rehabilitation, and it's just meant to insert a small pellet into the urethra and in the cavernosa and around, and then you kind of see where my cursor's going. That pellet will help increase the blood flow. Personally, and we've heard from our nurse navigator here in Saskatchewan, they haven't had the best outcome with this. But it's something that, another form of rehabilitation. If you can't take the Viagra for any form of increased blood flow, or if you have heart conditions, this might be another avenue to kind of use for increasing the blood flow in that cavernosa.
And also, before we go on from that one, when we're talking to the pathway and nurse navigator, apparently this is very expensive as well. So
Yeah.
there's a cost factor, but she said that they don't use it very often because it's not that effective. So the success rate isn't very good with that. So I didn't even bother trying that. She just didn't recommend it, and the doctor didn't push it either. So
yeah. For those who do go on this form of rehabilitation, they suggest twice a week to insert the pellet. And then it's the medication is absorbed through the urethra into the tissue. And they said that the erection can last anywhere from 30 to 60 minutes. So, you know, as I mentioned, each person's an individual.
Sorry, I have a lot of questions, but I just maybe off the top of my head, is there a cutoff time when you can start doing penile rehabilitation?
It depends upon you and your doctor.
Okay.
And it even to the beginning of when they want to start the penile rehabilitation. But by the end of the conversation or the presentations, Steve, let's get back to that one, because then we can kind of kind of clear things up with that one. But
Steve, sorry, it's Neil. Steve, do you mean, is there a time where it's too late for rehabilitation?
Yeah, like say it's been a couple of years since you you did. I mean, I know it wasn't a protocol here for many of us that there was no kind of rehabilitation. It was, have the surgery and then go home, and that was it.
Yeah.
That's the case for quite a few men I've spoken with. That was
Yeah.
kind of
Actually, no, that's a very good question, and I never looked at that in that fashion. Neil, thank you for bringing that up.
well, maybe it helped you there, Steve. For me personally, I didn't start till after my 3 month checkup, so I didn't do anything, and then it was after that, and then it took so probably 4.5 months after surgery before I started doing it. So when I was kind of researching all this before, I couldn't find anything or anywhere that said that it's too late to start, but the later you start, the less effect it'll have.
Yes.
So,
yeah. Okay, cool.
so my understanding, and to clarify me a bit here, is that it's harmful to start too soon, but possibly not harmful to start too late, just not as effective.
So, and you may,
if that makes sense.
And you may have to look at a different protocol as well, and it depends upon your doctor. I know we have a Dr. Garcia here in Saskatchewan, and that is his forte is that penile rehabilitation with both men and women.
Or didn't reveal women's penises.
No, good Lord. I got a nutcase here now. But anyhow, I wanted to kind of bring us back to the cavernosa and what it looks like. And here's some different pictures that'll kind of describe it a bit better. Now, this picture over here shows now this little spongy area is highly vascular. And this one is, I wanted to say it uninflated. A penis that is not erect or erect. And then this is what the cavernosa looks like when the blood flow has. And I guess it's very porous and very vascular. Now, this is penile injections, and Boyd and I can talk about this firsthand. In fact, yeah. Thank you, William. Yep. With the cavernosa and when like injections, and this is a learning process. It's and of course, being a nurse, hell, I know it all, right? I can inject that little puppy, but no, it takes a special technique. Now, the technique is here again, we have the cavernosa, and that's that tissue that is highly vascular. And it's basically the injection of the cavernosa with a medication. And I will discuss the medication here in a minute. And the medication is given via a very fine needle, and they are insulin needles. And at times, if you find that, if a fellow has had problems with the regular insulin needle, there's an ultra fine needle that they can give as well. So, and there's a reason for that. If some fellows find that it's just uncomfortable, or they just need a finer needle, there are ways in how they can work around that. With the medication, when I get to it as well, it's very important on how you store it, and it has a very limited shelf life, and the shelf life itself can be up to 3 months, but it has to be always refrigerated. You can freeze it and store it in a freezer, but you have to be always aware and cognizant of how long the shelf life is. Now, this might be great for someone who lives in a very in an area that's very isolated, or like in here in Saskatchewan, northern Saskatchewan, where they have to, they only get out of the north once every 6 months or something like that.
Lori, it depends on which drug, right?
Yes.
Plus,
Yes.
that's what you're talking about, the Trimix?
Yeah, well,
That's what-
there's several.
that's
There's
what-
several, Neil. And I have those different meds here too. It just depends upon the meds, and there is one here. I found that they have a Quadramix, which is 4, and I'm really quite impressed. I didn't realize they had one but these are American slides, so I must apologize. And these ones are from Johns Hopkins, which is highly reputable. And the names of the medications, and this is what we were talking about, and thank you, Neil, you brought that to our attention. Prasolil Vimix, which is phenethylamine, and that almost sounds like a virus, that one. And Trimix. I know Boyd was personally on the Trimix, and these medications are called a compound medication. Now, the reason why they call it a compound, here, I'll go back again, sorry. Compound medication is they have to be mixed up in certain pharmacies, and when they do it, they mix it up in proportion to what the individual requires. Now, I know our doctor, we had Dr. Jana help us figure that out, and Boyd had his first, we didn't have your first injection, we just talked to him in regards to it.
Yeah, when you meet the consult and met with the doctor, and then for me, and I'm assuming with other patients, we started just with the most common Trimix,
Yeah.
and I guess you play around with those medication variants, and then from there we just went and tried different dosages.
Yeah.
But for me, we just met with the nurse navigator and went through a little learning session, and then come home and do it real time. And the only problem I had at that point was trying to get the dosage right. So the first couple times I put too much. So
Yes. Go for it, Steve.
And what happened when you got put too much?
Oh,
it stays erect for far too long. So,
Which is a problem if you only, yeah.
yeah. I mean, it sounds funny. I thought it'd be funny before I experienced it, but
It's
no,
painful.
it gets darn uncomfortable. So
Yeah, I suspect so.
yeah.
Was, was there any charge for the consult?
No,
No.
not for the consult. For the medication, there is, because it's not covered under our provincial plan, or even like our private plan doesn't cover it. So so basically, to further answer your question here, so I got a bag of frozen peas, and so man, what's the other stuff?
Antihistamine.
Antihistamine or whatever.
I've got it all in my slides.
Yeah.
How long is too long?
Well, Neil, that
Thousands.
depends on the person, right?
4 hours.
For me, that was a little over 4 hours.
Yeah.
Okay.
They say anything past 4 hours, then you go to an ER.
Yeah.
But
You could fall asleep, have sex, fall asleep, have sex, keep doing that, I guess. Yeah.
well, yeah, right, yeah, or either that, or it's a little, it can be rather uncomfortable too.
Of course, it makes no sense. Yeah.
Yeah.
The reason why I asked about if there was a charge for the consult is because I know maybe other guys have experienced something different, but I know in Montreal, for me to do a consult, it'll cost $400 to get to see the doctor. And that's, giving you the training, showing you how to give the injection, and it's 2 hours and 2 hours. And so that's $400 out of your pocket. Yeah.
Well, that was all covered.
Yeah.
Here in Saskatchewan, yeah.
Okay. All right.
all those questions you've just asked, I have them all covered with my slides here. So you're like a Panasonic. You're ahead of the game here.
So we can just zip through the slides quicker.
Yeah. Anyhow, this tells you when you're going through the initial phases of the rehabilitation and trying to figure out, because the doctor will recommend that you try the medication first before you start having a sexual activity, just to see how you react with the medication. So no more than 3 times a week. So they kind of, you develop a regime or a protocol for yourself. So what they'll say is, example, you inject on Monday, Tuesday as a rest day, Wednesday inject, and then rest on a Thursday, and then Friday. God, we almost sound like we're doing a Bible thing here, but you know, and rest on our and inject on a Friday. They say you can inject back to back, but if you do that, then you have to
24 hours between each injection.
Yeah.
And then minimum 48 hours after the second.
yes, exactly.
That's what I was told anyway.
Yes, and it's got a kind of there too as well. This is what we've already addressed. Now remember, this is John Hopkins and this is US. They have, I don't think here in Canada they do it in Walmart. I'm uncertain if in Quebec you have a CVS, but that's American. But we do have a special pharmacy. There's only 1 or 2 in Regina that compounds and does these things up for us. The risks of injection, and one is scar tissue, because you stop and think it does. It's going into that material, into the cavernosa, going through the tissue, and you can experience scar tissue. William, I'll explain the nurse navigator in a minute, William. Prism, that is where you have an erection longer than 4 hours. Now, if it's longer than 4 hours and there is a protocol that you can do at home to help with that, Boyd discussed part of it, a bag of peas and resting with your feet up, trying to reduce that. The scary part, and I don't want to scare you, but it is reality, is that if you go into ER and you've done all the things that you were supposed to do to help yourself decrease the blood flow in the penis, they go in with a large bore needle, go into the penis, into a blood vessel, and withdraw the blood. So I think you've seen that when you work.
Yeah, I've seen it.
Yeah.
It doesn't look good, but,
No.
but the poor guy was in such pain when he came in, he was actually relieved, so.
Yeah. Yeah. So, and of course, and now a nurse navigator, William, here in Saskatchewan, a nurse navigator is a nurse where we have pathway programs here in Saskatchewan. And what we have is the prostate assessment pathway, which is prostate cancer focused. And it's run by urologists. And what they do is a nurse navigator will help you walk through the process, get through all the regime or the protocol, or I call it the political bullshit that one goes through in regards to healthcare. It's kind of like your own advocate in regards to that. The other thing is a nurse navigator are highly trained in regards to their skills for these areas, and they are a go-between.
Yeah.
Honey,
so,
can you give them an example,
yeah,
please?
Well, it just kind of like, to me, I look at it as like kind of a conduit between myself and the doctor, and then they can filter out anything in between. So if you have, for me, if I had any kind of questions, like I had my blood work done last week and I had some questions about it, so I just got a hold of the nurse navigator, and then she in turn got a hold of the doc and the biochemist and did all the research and then got the answer for me. So it just, it's kind of like a stepping stone to the doctor. So most of the stuff that there are any questions or anything that I needed, she could do directly with me, such as like the injection stuff, the penis pump, that sort of thing. She directed me that way.
Surgery.
And the penile implant surgery, she did all that sort of stuff. So it just kind of it speeds up the process. It takes a lot of the, I think, the weight or the work away from the doctor, so that the doctor can spend more time with the patient, and they get a far more timely response for any inquiry I have from her. So
So
that sum it up there for you, William, or still not clear?
another thing that I wanted to bring your attention to was with the pathway programs here in Saskatchewan, what we found is it would reduce your waiting time with some of the docs. Like some of our patients here in Regina, between Regina and Saskatoon, we have different standards of care. It shouldn't be, it's all the same health region, but there are different standards of care. In Saskatoon, some of our patients who see the clinic up there have far less of a waiting time. Example, Boyd had some of his answers done within a whole complete week of what he'd done. Here, some of our fellows will wait as long as 3 months to get some of their questions answered, or even referrals. So that's kind of gives you an idea. Okay, now this is the medication that you use. Now, if you find, if you are on the injections, Sudafed, it's an antihistamine and it helps reduce the blood flow, plus your bag of peas. And if that doesn't work, I can't remember how many times did they say you had to use the Sudafed? Twice?
I don't remember.
I can't remember. I thought you
I don't
tried it, and then if it's still congested, tried it one more time, but it had to be within that 4-hour period of time. And if it didn't work, then off to ER you go to get that other treatment.
So for me, it was the Sudafed and the peas, and everything worked fine after.
There you go. And a very sore dicky do.
Yeah.
Okay, and now we're going to go on to the different styles of penile implants. And I bet you some of your fellows have been kind of wondering, what the heck? When is she going to get to that part? But there are 3 different styles, and I may refer back to this picture later on. There is a 1-piece, a 2-piece, and a 3-piece. And Boyd was extremely lucky, and he had the doctor had recommended the 3-piece with Boyd.
Well, there's only 3 surgeons in Saskatchewan that do penile implants, and they all use the 3-piece the device. And Lorrie will speak to that in a minute here. But
okay, so the 1-piece, now if you notice, it kind of looks like a bendy straw. It's not really, but it has that look to it, and it's more pliable. And I'll talk more in regards to the pros and cons of all these devices. Now this is what it looks like. Now you notice like that little bendy straw is kind of, and of course it's in the relaxed position, and then that's where it's erect. So it kind of shows you. And it's just very simple. They bore out the cavernosa. Now remember those very spongy vascular areas, and they put in these bendy devices. A 1-piece implant, it's semi-rigid cylinders that are placed in the penis, responsible for erections, and at least the least complicated kind of prosthesis and the easiest to use. However, it has the least natural looking and a natural feeling erection. Has the least natural looking and natural feeling erection as compared to other implants. But I'll discuss the other ones as well. This is a 2-piece. Now I kind of look at it. Now it has the inflatables. It has, and I almost kind of think this is a picture of a 3-piece, but I'll further explain it with the other pictures here. Now a 2-piece, this is an implant that adds a pump and is popped into the scrotum, and it's to fill the cylinders in the penis. Now when it's filled with fluid, that's when the erection will be maintained or raised. You can drain it by bending the fluid or moving the penis to release the fluid that's in those reservoirs in a certain direction, and that's obviously something that they would discuss when they give you that teaching. It may not be a good option if you're thin or have a larger penis. So there you go. This is a 3-piece, and the difference that I want you to be aware is the 3-piece will have the reservoir, a very long tubing, and then you have like a valve. You don't have your little valve here, do
Oh,
you?
really?
Yeah. Okay, so Boyd's going to get this for you so that you can see it as well. And with this 3-piece, this is where they have the reservoir, and it's up in your pelvic region or just in front of your bladder. And that's where all the solution will sit. Now, when you want to activate and have the erection, there is a special pump. And it looks like, well, here it looks like a little hand grenade. They say it looks like more like a pineapple. And what it does is to get the area to pump up. I'm trying to think, I'm lost for words here. For the erection, what it'll do is with this pump, you turn it a certain way to get the fluid in, and then to release it, you can release it, and it's another direction.
Anyway, so here they give you, for me, when I got mine done, they give a little keychain with a pump on it. So, and I'll give it, there's a hold of pen, so it gives you an idea of the size comparison. So that's what the pump is, and that's basically you have a third ball after this. So it goes in the scrotum. And like I told the doc when I came back from my checkup, I said it feels like there was a turf war going on in there because there just wasn't room for all three of them at that time.
But hey, you work through it.
They work through, yeah.
Yeah.
Once the swelling goes down and that, it's fine.
Yeah. With a 3-piece implant, this device involves the same mechanism as a 2-piece, but the pump can inflate and deflate the penis. It pulls the fluid from that reservoir, as I mentioned, in the lower abdomen to create the erection and send it back to the reservoir to return to your penis to a completely flaccid state. So whereas with the 2-piece, you will not get a completely flaccid state. Some of the solution still sits in the penis.
And the 1-piece is the same.
And the 1-piece, yeah. Now with the 3-piece, now this is from a doc in it's Utah, I believe, Salt Lake. Dr. Brandt, he usually recommends the 3-piece penile implant unless there's a safety or medical concern, and that prevents you from getting it. The 3-piece device offers greater rigidity and flaccidity, and most importantly, gives you a total control over your erection. Penile implants. Now, these are the cons. The biggest drawback to penile implants is its permanence. It's permanent. It's there. Once they bore out that penis and put in those implants, they cannot replace it. It's there for good. Well, unless they have to remove the implants.
But the cavernosum is completely gone, so
Yeah.
there's no more erectile tissue left.
Yeah. In most cases, once you receive it, and no longer achieve the erection by natural means. So, and that's even by medication or such. So you really have to take deep thought when you go through each of these processes. The other con is a slight risk of infection. And with this doctor, it was 1%. And that is really quite dramatic, 1%, because I know personally as a nurse, I've seen higher rates with different types of surgeries. So they always, I know with Dr. Domes, who did voice surgery, he mentioned that the implant that he used was coated with an antibiotic to help decrease that. And within the first day or first few weeks or so post-operatively, that is really a great advantage. The penile cons or implant cons. Now, I don't understand why they call this a con, but they say it's an outpatient procedure and requires recovery time at home. And for some people, that might be a pro. I don't know. There's a higher chance of malfunction with a 2 or 3-piece, but because obviously there's more pieces involved, and of course, things may go wrong. There's less rigid erections with a 1-piece because it is more flexible, and it's like the bendy tube or that bendy straw. They say constant pressure on the penis with the 1-piece may cause injury in certain kinds of patients. So I guess it may be rubbing on your underwear, or if you've ever seen What About Mary, where that poor guy had his penis caught in the zipper, God forbid, I hope something like that never happens to anyone. Yeah. The penile implant pros, it allows you to control your erection. It's easy to use. long lasting, good for up to 20 years. And that's pretty good. That's even better than a refrigerator now, I think. Although it depends upon the combination of use. And I love this word they put in here, luck. I don't know if that's how many times you get lucky with the use. I just kind of sit back and kind of have a little bit of a chuckle with that. And it's also a high patient satisfaction rate. It returns your penis back to a flaccid state when not in use by deflating the 2 or the 3 piece or bending the semi-rigid cylinders. And the best solution for ED that either doesn't respond to medication or other treatment, or if those treatments are unsatisfactory. Now, I want you to be aware that there is a protocol that the doctors will follow before they go to something like a penile implant. And I know Boyd and I both went through it, and the doctor sat down with both of us and spoke with us in regards to the implant and what it was that we were looking for, and was it for us? And of course, he asked Boyd, the big one is,
well, in Saskatchewan anyway, to get covered by the provincial health plan, you have to exhaust all other avenues before you go to the implant. The government won't pay for it unless you try the others. So basically, you had to go through for me, because I had the radical prostatectomy, that the drugs was off the table completely. No point in that. They don't recommend the little insertion thing, so they didn't talk about that. But we did talk about the pump and the injections, and then he just wanted to know why why we weren't satisfied with them, why they didn't work. So I explained why we didn't like them, why I want something different, and then he said, "Yep, that's all he needed to cover off his part of it for the government to pay for it." So that was pretty much it. Then just go on the waiting list, and of course with COVID, everything slowed down, so it took about 1.5 years, but got done.
And another thing, like with the implants that both Boyd and I kind of chatted about as well, and we looked at all the pros and cons of everything, of his whole protocol or his whole penile rehabilitation, and we looked with the injection. Of course, it takes anywhere from 15 to 30 minutes for that to take effect. And then, of course, you had to look at the side effects as well, like the scar tissue and damage to that. Of course, it can cause some bending, or I'm trying to think of the medical term, cronies, thank you, where you have a bit of a bend. And in Boyd's case, at post-surgical, he had a bit of a bend in his penis as well. So that the implant helped improve that for him as well. We looked at those, and we came to the and the spontaneity that was really quite beautiful on our part.
Because like I said, spontaneity with the injections for us was about half an hour.
Yeah. Hey, honey.
Yeah. What are you doing in 15-20 minutes from now?
Let's watch a movie.
Yeah. And then again too, then if you're storing the medication, like some folks we talk to, they freeze it. So of course, if you freeze it, you got to take it out to let it thaw before you can put it in the needle. Some will fill up needles and freeze them, so they told us. So
yeah. So it just depends upon the couple and what you discussed. Yes, Steve.
So Boyd, are you completely satisfied with the whole process, the operation, going through it? You're really
for me it's better than I expected. So
okay.
Everything works well. The actual procedure was far less painful than I anticipated. So for me, and there's one of the guys I used to work with, he's a retired guy from Saskatoon, and he had it done, and he was telling me beforehand, he said he was surprised at how little pain it was, and I thought he was just stringing me or trying to make me feel better, but no, he was right. I mean, it was I just took Advil and Tylenol as a combination. And after about probably 2 weeks, it was a little discomfort, or you just feel a little bit pulling if you're not sitting right. It was by 3.5, 4 weeks, it was nothing. Yeah.
And how long is the actual operation? Do you know? How is it?
There again, we went in the hospital. I think I was in 7. We went into register. I think into the free thingy about 8. I don't know. Was it a couple hours? I think the procedure.
An hour and a half.
The only downside that I had that took so long has nothing to do with the device, was I had a spinal block. So of course it took about 8 or 9 hours for my lower body to start working again. So,
Okay.
but if I had the normal, like the general anesthetic I've had in the past,
Mhm.
I would have probably gone, 4:30 like everybody else.
But that in Boyd's case, because of the spinal block, Boyd also suffers from ulcerative colitis.
Okay.
And with the spinal block, things stop
Yeah.
because your parasympathetic and sympathetic,
Yeah.
those stop. And in Boyd's case, it created more of a
Yeah.
problem
So
with his
so like I said,
bowels.
so that took about a day for my intestines to start working again.
Yeah.
But like I said, that's got nothing to do with the implant. It's just strictly with the anesthetic. So
Because hearing, when you talk about boring out the vessels, I'm like, whoa, boy, that does not sound so great.
yeah.
Go down there, do some mining. It sounds like you're
Yeah.
going into there or
Yeah.
something.
Actually, before I found some good videos in YouTube that are very accurate, and they I
Okay.
kind of watch them, and then I do some reading and kind of run it by the nurse navigator or the doctor or where I met with him, and it's quite accurate. So it sounds bad, and I'm not a big fan of blood, but
Yeah.
it from a pain point, it was surprisingly painless.
Yeah.
So,
And one of the things too, like after surgery, of course, you're going to have a catheter in. If you've had a prostatectomy, you have a catheter in after that. You do have a catheter in after this procedure as well. But the doc, like I was really quite impressed with him, and I'm a nurse. I was impressed by his dressings, and usually docs don't do very good dressings. And his dressing was very impressive, other than the fact that he had his tape in some very uncomfortable areas for Boyd, but say la vie. But it worked for him. And it was a form of a very a pressure bandage, and it really helped keep all the swelling down. And within the 24 hours, swelling and bruising, you will have a lot of that. But Boyd had very little of that. And I think he had more with his prostatectomy than he did with this, which is just excellent.
Yeah.
Has there been any change in your bladder function at all?
Oh, there you
Well,
go.
there again, it's funny you ask that, because I always said to Lori, I said, it seems odd, but I said, you seem to have less leakage now. And, but that, if you think about it, I mean, it's a different part of the body, but I guess it must just put enough pressure on the ureter that it maybe just holds it back a bit,
Yeah.
or maybe it's all psychological. I don't know. But,
Or the urethra,
That's
'cause
interesting. Yeah.
yeah.
we
yeah.
had a discussion or a talk with Dr. Chan, and that was his forte was urinary incontinence, and the devices that he puts in. And we kind of chatted, and I said, well, there's a 2-for-1 deal here. If you go with the pump, if that helps both, help relieve both. But remember, each person is an individual, and you have to look at that.
Yeah,
So
Yeah.
now I wanted to end off our presentation with a bit of humor, and we all have to see a bit of humor. And I kind of pointed that out earlier in one of my slides. I find this is a great way to end off any discussion. And I found some sayings here and some quotes, and I kind of thought, Buddha would love, have to say this one. No matter how hard the past, you can always begin again. Hard, past, beginning. Hey, a little sleight of words there. And I love this one too. There's no shame in beginning again, for if you get a chance to build bigger and better than before. La-di-da. And new beginnings are often disguised as painful endings. And I think a lot of moms look at this as after they've gone through labor and birth, and they say, yeah, well, that was well worth it. You have to look at your own individual wants and needs, and go from there.
So I have a question for you, Steve, or even William or Neil. In Quebec, does the government cover the cost of the implant, or do you know?
I spoke to my urologist, and he said it's covered. But like you said, you had told me before, you first have to try the other techniques.
Yeah.
Right. In Saskatchewan, it is, and the same in Quebec then.
Well, that's what he told me. I specifically asked him. I said, if are these are the implants covered? But again, to get the surgery for the implant, is that your grandchildren?
Oh, it was. Yes, I'm sorry. I'm going through a
It
very.
was a nice picture. You can put it back.
Yeah. Bring back the winter here, right? Yeah. Lovely.
Yes.
Anyway, I'll get Lori to put our email address into the chat. So if anybody has any questions,
Yeah.
down the road or whatever, that I can maybe answer for you from a patient perspective, and I can tell you what I experienced firsthand. I don't mind sharing that with anybody. So
I really appreciate you sharing this with us, Boyd. I know it can be, it's a very private subject, and I think it's very courageous of you to share that, because I don't know if I could,
well, probably if you asked me this 3 years ago, I couldn't.
Yeah. Okay. Well, we're in the
I
present
wouldn't have
now.
to.
Yeah.
Yeah.
But I know in our circumstance, and me being a nurse educator as well, and and also when Boyd went through his prostate, or he's still going through his prostate cancer journey, it's a fact that we wanted to pay it forward, and we did not want to see people go through. We wanted to give people support, and that's why partially why we got into what we do, and also that picture of our 4 grandsons. They're at high risk for prostate cancer, and we wanted to make sure that we had something in the future for our grandsons.
Yeah,
So
absolutely.
that's extremely important for us and for the future of all fellows of couples. It is a couples disease, and it does affect couples. It's very much so, and it does impact your life. I know the other night we had a meeting. It was a partners meeting, and with that partners meeting, what had happened, one of the ladies had said that her husband was diagnosed with advanced stage prostate cancer, and of course, one of the statements made to him was, "Well, it's one of the good cancers. It's prostate cancer. It's a good." Hey, no cancer is a good cancer.
Absolutely.
It has impact. It changes your life. So that's my 2 words.
But I mean, along that same line, just before we go on here, even met with one before I had the surgery and had to go see, get our prescription refilled. And we saw a doctor that we normally don't see. We doing the locum for a regular GP. And he was even trying to talk me out of doing anything, because like he said, he says, men die with prostate cancer, not from it.
Yeah.
So, I mean, even get the odd doctor that still, I think, needs to come up to speed.
Yeah.
Misinformed there, bedside manners aren't always their strong point, That's
Yeah.
for sure.
Well, and plus it's the education portion too. Everyone, even docs, we all need to keep ourselves current and educated.
Yeah.
So, now
it's 8:30. So great presentation. I always feel like I'm learning new things all the time, and there was definitely a lot of things I learned just from the great pictures, by the way. I love the pelvic floor pictures as well. You don't realize how many muscles you have down there and how important it is to keep those things going, So do guys have any questions? Hands up one at a time, maybe. Don't be shy.
I don't think I was that thorough. Now I'm putting our Boyd's email address in the chat. You're very welcome to pick that up. Gentlemen, any questions for us? Yes, William, go for it.
Can you hear me okay?
Yes, we can.
Yeah, so thank you for the presentation. I just wanted to ask, if I wanted to get a diagram of what you had showed, how would I ask for that? Through the hospital or?
You mean of my PowerPoint presentation?
No, just of the diagram of the different parts of the prostate and the penis, that whole area in there. Like, how do you get? There was a very good diagram with the soft muscle. I mean, there's quite a few nerves.
I can send you that picture, but you can also just Google it.
Yeah.
Just Google prostate images.
Yeah.
Okay, well, why don't I do that? And if I can't get it, just go to Google. So it's Dr. Google prostate images. Okay, good.
Yeah.
Thank you.
And I did send Neil. I did send you the PowerPoint as well. Correct?
That's why Neil could send it to him. That's for sure.
Yeah. Yeah. And Neil, you can send him the whole PowerPoint, because there's a lot of great pictures there. I see one of my fellows. Bonjour, comment ça va? He knows who I'm talking to. Sylvain. Yes, Norbert.
I know there's one French fellow here. Yeah. Norbert,
Yes.
you have a question, Norbert. Go ahead.
I had the mute on. Hi, thank you for the presentation. It was quite informative. I have a question in regards to those that have gone through surgery vis-a-vis those that have gone through radiation therapy. Is there a marked difference in terms of the after effects and recovery?
Okay, now, if I hear you correctly, you mentioned that you've had radiation treatment.
Yes,
What type of treatment did you have? Did you have external or internal or brachytherapy?
external. It was external, 38 sessions
External?
radiation.
Okay, like it just depends upon, and oh, pardon me, one other question. How long ago?
I just finished January 4th.
Okay, because with the radiation, what can happen is it can be delayed, some of the side effects, because remember that the continuation of the radiation treatment will continue to work after the fact, because it may not affect you right away like the prostatectomy, but it may take up to a year for you to notice more of the side effects after the fact. So, and some don't, it just depends upon the person, depends upon the treatment that you've received. But I always say to my fellows, do you get to see your oncologist again, your radiation oncologist? Yep. And I'm going to say, you write that question down. You ask him, both you and your wife, you go there and you write that question down and say, hey, what are my chances? Because remember, you are an individual. You are your own person.
Okay, thank you.
You're welcome.
It makes me think about something, Norbert. I was thinking, you asked somebody who's had radiation versus someone who's had a prostatectomy in terms of having a pump. Do you think there would be any difference in terms of, possibility of not having one, or because radiation is a little different than having a prostatectomy, obviously.
Well, it may not affect a person right away. It could be after a point in time, a year from now. So,
Yeah.
but remember, if you start noticing a change in that functioning, in the oh God, I'm having a brain fart here, people. In the erections, then you'll know that it's time to start forming or starting some form of
Rehabilitation.
Yeah.
We're kind of further along that line. When about 3 months after my surgery, I kind of was having these second thoughts about like, what have I done, sort of thing. And then I did more research into the radiation, and what all the reading I did said that radiation will probably end the same as a prostatectomy. It just may take a lot longer. So there again, it depends on the individual and the radiation, all sort of stuff. So I was kind of second guessing having the surgery, but along those lines. But from what I learned, you'll end up the same. It just takes longer. So,
but I want you also to remember that each of you are an individual, and I can't say that any more than what I do. And in Boyd's case, Boyd could not receive radiation. He was supposed to go for brachytherapy in Vancouver, and because Boyd has ulcerative colitis, he was not a good candidate. Because remember, and each person again, an individual. With surgery, if you have surgery, you can always fall back onto radiation if the surgery doesn't help, or if they don't get all the cancer cells, or and the other thing is if yes, thank you. I may have gotten that backwards.
yes. Well, you had it right. Just finish it. So if you have the radiation first,
Yeah.
then you can't follow up with surgery because it's too much scarring.
Yeah. So, but remember, each person's an individual.
Yeah.
Okay. Are there any other questions?
Does anyone have a question around the penal pump, or questions for Boyd? Maybe about it. Maybe I know I've always got a lot of questions, but Boyd, what you talk about all the great things that happen and how it's improved your quality of life in the bedroom and all this stuff. What's the others? Were there any downsides? Was there anything like wow? And obviously you talked about questioning your decisions. Were there any was there any stuff that you had forgotten to mention? Maybe, you know, like what changed? You
Hmm.
know,
Oh, I know.
Okay.
I'm asking Boyd, it's not your turn. No,
Oh,
just
I
kidding.
know, but I do, I have.
Well,
to
actually, you know, like what happened was, you know, when they said to start questioning about 3 months after my surgery, and I woke up one morning and I said, I'm incontinent. I can't get a hard on. I said, what have I done? So
Yeah.
then Lori just kind of said, well, remember, the surgeon told you these are the side effects and be prepared for it, but don't get all hung up on it because there is, you know, treatments for it. So once I
Yeah.
kind of got myself grounded, and then he just started falling back on the whole process and took care of the incontinence and went through with the erectile dysfunction, and so now I'm, you know,
So
I'm
how long has it been? How long has it been since you had the penile implant?
I got done last August,
Yeah,
I think
not
last
even a
week in
year.
August or something like that.
Okay, so September, October, so it's been 4 months. How has that changed your life?
Yeah, it's a lot more like it used to be.
Yeah.
Like you don't have to plan ahead when you want to. Like we travel, so I mean, you gotta, if you want to take the medication with you, you have to find some way to transport it, which we did. So if anybody you know, has any problems with that, I have a couple of solutions that we've done for traveling. But it's for me, the most part was more the spontaneity. So
And
No.
the one thing I'm going to speak up here because
that's my question.
yeah, the one thing is I noticed that since Boyd's had his prostectomy,
Mhm.
he is more sensitive, and I have to be more mindful of, you know, of his sensitivity. Now I always joke, and Boyd knows I always joke about this. I'm more of the masculine, he's more of the feminine. Not saying that we're gay or anything like
Yeah.
that. It's just a matter of fact for our relationship.
Couple. Yeah. Okay.
Yeah, and I have, but mind you, the older I get, I really don't give a shit what someone thinks when I say something, you know, and I think it's that, you know, but still I have to be mindful. So, and one of the most impressive things that's happened, and after almost 50 years of being married, Boyd was able to pick up something and say, hey, honey, what did you mean by that? Explain that for me. And it's little things like that that we all have to be mindful as a couple, as a partnership.
Sure. Yeah. I realize. Yeah, I agree with you completely, 100%. It's a couple thing. It sounds like you guys have really great communication, you know, and you're very an open. Obviously, you're very open about your, you know, your medical procedures and stuff like that. And I think that's a rare thing. I believe, you know, I don't see it a lot. So I congratulate you on that for sure, because it brings a lot of insights that we might not have access to, you know, as you know, as couples, you know.
Yeah.
That's
I
for
just
sure.
want I just want to make sure that the email is in the chat there. So if anybody has a question or whatever, you know,
Yes.
anytime, just
Yep.
fire off an email. I may not get back to you for a few hours or the next day, but
What
So,
I'll also do is I will give you our phone number. And that's for those of you who may want to talk directly, because Boyd and I also do peer-to-peer, and we are on the national, or we will be on, especially for women. Norbert, did you have a question? Yes.
Yes. If is being on ADT a limiter in terms of the options for the treatment that you discussed?
ADT. Okay, now you're gonna notice with ADT. Are you on ADT, or are you considering it?
No, he's on it.
I'm on it.
On it. Okay. And are you having any side effects as of now?
Sorry, for those who don't know what ADT is, it's androgen deprivation therapy. It's hormone therapy.
Yes. Thank you very much, Neil. Yes.
Thanks, Neil.
And because, but it's not female hormones. It is androgen deprivation. There's different ways in how the hormones do affect. It's generally through the pituitary and other glandular, you know, and there's a couple of different forms, and I can't remember off the top of my head the different forms. I do apologize. But in regards to penile rehabilitation, I know a lot of times it'll decrease the libido. And a lot of women will notice this too, is the decrease. You may still want and desire with the libido, and you may feel exhausted on ADT. You'll have hot flashes. You may start getting a bit of a belly. Welcome to menopause. How's that sound? You know, and yes, and we as women, we've suffered with that, and now we're sharing it with our fellows. How's that sound? But you know, and I always recommend, there's some excellent books out there. There's one that they have through the prostate cancer support BC, and through the foundation, through the National Foundation, that they talk about ADT, and I can't remember his name off the top of my head. Yeah, in regards to ADT, in regard to ADT therapy. Oh gosh, I'm so sorry, but it's an excellent book, and please use it as your Bible, and never stop asking your doctor. Okay, never ever. Okay.
The doctors are, as knowledgeable as they are, seem to be a little bit skippish on their sharing of all the information that is required.
Yeah.
And that's been one of my, that's been, here's the book.
There you go. Yes. Now, oh heavens, is it Richard? What's the doctor?
Wasserberg.
That's, yes, he's a sweetheart. He's a sweetheart. He and I always tease each other. So yes, yeah. So he's actually, and that's a very good book to have on hand as well.
Yeah, we just got it. Yeah.
Excellent.
Read
Excellent.
through it. It is an excellent book.
Yes. Yes, and it'll kind of give you a heads up. Another one that we have that'll kind of give you a good heads up, and it's Glenda Stevenson. She's also out of BC, and she kind of gives a couple's perspective as well. And she's also the leader for our partners group. So there's so many excellent books and stuff. But I always suggest, Richard also has a YouTube a video on the national site that discusses where to find reputable information and how to find it. And that was at our last national conference. So I do highly recommend, if you're going to look up Dr. Google, do it right. Okay.
And also, Richard, we'll get to your question in a second, Leslie. Richard is also, I've texted Richard or emailed him, and he's responded, you know, so
yeah.
he's very accessible as well.
Yes,
Well, if you're reading the book and you have questions, you can say, Richard, I don't really understand this. He'll get back to you. You know, he's really invested.
Yeah.
Okay. Leslie, you have a question.
Yeah, no, I was just going to, excuse me, talk about my experience. I've just had my 4th Allergard injection, 6-month injection. And yeah, my body shape is changing.
Yes.
My libido isn't there. But then I'm now 81, and I've been single for many years, so I really don't notice a great change there. I'm still quite active in the summer and everything. I sail my boat and I walk in the winter some days, but not tonight. It's too cold. But so, you know, yes, there's been some side effects, that nothing I couldn't cope with.
Yes.
And in terms of books, if you're a patient at the SHUM in Montreal, they can give you a book that's by one of the people, that's McCormick and another name. I forget the name. Perhaps you know the name, Steve.
Doesn't ring a bell, but I was at the SHIM as well. They were not giving out too much stuff, that's for sure.
No, I went and bought on Amazon that book for about $20. And when I got down to see my urologist and the Dr. Saad, that was at the thing, they had a pile of them on a tray there, excuse me, in both languages, but I didn't take a second one. But I'm kind of, this is a little off topic, but perhaps you can help me, Lorrie. What are they likely to do after the hormone treatments? I'm not a candidate for radiation because I have ulcerative colitis also. And they told me, oh, we want to preserve your quality of life. And at first I heard that as, oh, they're going to keep me comfortable till I die, which then I realized that wasn't a good way to think about it. And so I'm in the category, hopefully, if I'm going to buy with, not of. the
You know what
prostate
I'm going to
cancer.
suggest is for your quality of life, Leslie. What do you enjoy the most in life? Do you feel as though you've written that last chapter in your book of
No,
life?
no, no, no,
In heavens, honey, go
Yeah.
out and celebrate life.
no. Yeah, well,
Yeah, you know
I-
what? Oh, if you're playing baseball, you slide into home plate and say, "Yeehaw, baby, I did it."
yeah. No, I don't sit around thinking about my problems.
Yeah.
I mean, I over the years, I've gradually given up cross country and downhill skiing and all sorts of other
God,
things.
man.
But once you're 80, you're not so good at those things anyway.
Yeah.
So Leslie, if what I'm hearing, maybe what's your biggest concern, like with the because you were asking Lorrie after they're finished the hormone therapy, what's next? Is that kind of like
Yeah.
what are you expecting to be next?
Well, I'm not sure. I don't really have to worry about this for 6 months because the thing they injected lasts for 6 months. And I've talked to my doctor a few months ago, and I've sent her a voicemail message. And if her office doesn't reply soon, I'm going to write her a letter because I figure I've got 6 months to have that discussion with her.
Okay.
So that's my experience, and I've got a concern, but it's not an urgent concern.
Yeah.
I mean, the summer's coming.
Well, in 6 months, you're going to be it'll be an urgent concern, that's for sure. You know,
Right. Yeah.
So best to prepare now, and like you said, ask the questions to your doctor, and
Yeah, I mean, I asked the questions of the nurse who came to the house and give me the injections, and she said, "Oh, many people have another go at the injection." My PSA, I've done all the steps, wait and what, do this, and my PSA was never very high, got to 19, and it's now 0.43.
Okay,
And
good.
they'd like to get that down to 0.0 something.
Mhm.
So I wonder what they're going to do,
Okay, yeah.
So
There may be a combination of medications.
Yeah.
You're not castrate resistant cancer, are you?
I don't know, but I don't think so. I don't know.
Because
Maybe if I can, sorry, Lorrie, Sylvain, do you have anything you wanted to add to Leslie's? Because from what I'm understanding, Leslie's concern is, what happens after 6 months? I've had that, that last treatment, the last shot. What's the next? What's a possibility? How would you answer that, Sylvain?
But it's not very difficult. So usually, since COVID and stuff like that, doctors prefer the longer period of time in between you have your injections. I lost a little bit, but I don't know if you're on hormone therapy for a while or if they will give you that for life, because this is a little bit a different story.
Yeah.
The thing is, it's not like Tylenol or other medication that we take. In like 30 seconds or a minute, they inject you the stuff and you're gone for 3, 4, or 6 months. So you cannot change your mind 10 minutes after that.
No.
And decide like next day I don't take Tylenol because I don't like that. It's not like that. It works. So you're cut with your medicinal stuff that will work for the next 6 months.
Right.
I've got the I was on hormone therapy for 5 years.
Okay.
And I've tried the 3 stuff, and the last stuff was the little bit more modern one, but it was requiring an injection each 4 weeks. The thing is that kind is supposed to have a lesser impact on your heart and stuff like that. So the thing is, when you're on hormone therapy, your libido will be gone. Because you have the thing is they want to remove your testosterone from yourself because testosterone is fueling the cancer. So they do that with injections, and there is your PSA is still like near 0.3, 0.4, 0.5, because in your body you have I think in English is seminal glands that are producing a little bit of testosterone, because the testicles produce like 90 or 95% of the testosterone, but when they are stopped, there is still a little bit of testosterone produced by your body that the cancer will use. If you're super anxious, you can probably take talk to your urologist about, they call that a total blockage, meaning they will give you another, but it's in pills. At that time, it's a little bit less invasive. That will probably stop the adrenal glands from producing testosterone or the cancer cell to absorb it. I don't know how it works, but they call it, I think, bicalutamide and stuff like that. There is certain side effects to that, like gynecomastia, where your breast is enlarging and they are more sensitive and stuff like that. But it depends on your doctors. It depends on, because my cancer was super aggressive and I was only 50 years old at that time. So they didn't want to take any chances.
No.
So that's why I had that. Your case is probably different a little bit. The thing is that with people on hormone therapy, the very important thing is do exercise as much as you can. It's very difficult because your brain is like, you love your couch a lot, and it's normal because your fuel to do stuff is gone. So if you force yourself to do exercise, and there is a couple of places where they can Zoom stuff with exercise for prostate cancer people and stuff like that, and it lessen the effect it will have on your body, like muscle mass and bone stuff and all those kind of problems are mitigated by exercise. So, and I've talked to a lot of buddies that are on hormone therapy, still on hormone therapy, and the one that are doing more exercise because it was like in their life before, and they tried, they didn't stop. The side effects are a lot less for them. So it's kind of a miracle pill that doesn't cost anything. And studies have shown that people that are doing a lot of exercise are better, live better, feel better, and all that stuff. So it's particularly important for people that are on hormone therapy. It's very hard because your brain doesn't want to go and take a walk or go to the swimming pool or whatever you like to do, but you have to force yourself to go. And
No,
if you can have buddies or something like that, it's good.
Yeah. I hear what you're saying because, I like to go walk around the block, walk around 2 blocks some other days. And of course, my phone counts the steps.
Great.
So
yeah, give you like a little objective, to go a little bit farther each day.
I think
So
it's a good point you're
that's the
making.
thing.
I think it's a good point you're making, Sylvain, that, not only are you physically affected by the therapy, but also mentally, like you said, your brain is telling you, I'm not going to, you stay here on this couch. This is where you belong. So it's really important to fight it because, research is saying that people who are exercising have a better quality of life physically and mentally, and our mental well-being is just as important as our physical well-being. They go hand in hand, that's for sure.
I mean, it's a bit hard to go walking, when it's 20 below. I used to live in Winnipeg, so I know what cold is like.
Oh yeah, okay.
And it's never really that cold in Montreal, not often anyway. But,
The alternative that Sylvain was saying, like to go on Zoom and find like an exercise, video, whatever, and just do it. And I like Sylvain. I think you have really great information because you speak from experience. Where the coach was calling you every day. And you managed to get through that and do a little bit of exercise and feel better about it. So keep giving that message. I really appreciate that. Does anyone have any other questions before it's already after 9? Anything else for Lorrie before, what time is it, by the way, where you are, Lorrie in Regina? It's you're early, right?
After 8.
Okay, so you're
8
just an
o'clock.
hour. It's not, yeah, okay. So,
Yeah,
okay,
well, it's not so bad. We're an hour different.
Yeah, that's pretty good. That's pretty good, actually. Does anyone have any other questions? All right. Well, I want to thank you all so much. And most obviously, I want to thank Lorrie and Boyd for being so honest and courageous and giving us all this incredible information. I'll definitely be calling you back again, Lorrie, because I love what you have to say. And as well, I'm gonna probably not tonight, but I'm gonna ask you about a few things about the navigation systems and because
Yes.
we really don't have that here. Like that's one of the biggest missing things in Montreal is that, you know, that's just not been organized yet, you know, and maybe that's something that's the support group might have to take on some angle,
Yeah,
you know.
and exactly, and advocate for. So
Yeah.
there, you and I have a job.
Okay. All
have to
right. Well, I
work
already
hard.
have a job in the day, but I'll try and do something at night as well. You know, yeah, no, it's really important because the navigator is kind of almost a support system as well
Yeah.
for our gang, you know, and a lot of times, like couple guys were saying that, you know, I can't get in touch with my doctor. I'm waiting to hear from him. Well, that's the navigator. It's a mediator between the doctor and the doctor is going to take the message from the nurse before he does from a patient. That's just our reality.
And I know I've kind of advocated one-on-one with some of our fellows here as well, because the nurses, like the nurse navigators, have gotten in touch with me. So I believe you work as a team. You don't oppose
Yeah.
each other, you work together. So I
Absolutely.
know Sylvia and I are working towards getting our urologists on board throughout Canada. So and that's a work in progress as well.
Yeah,
But I wanted to say, you fellows always, you have such interesting questions, and I always enjoy speaking with the Montreal group.
Thank you so much. I very much,
Yes.
you know, thank you so much.
Yeah.
And just to let you guys know that next month, we're going to be doing a presentation about a lawyer's going to be coming in or Zooming, we're not sure yet. And it's going to be on wills and testaments, which are, you know, there's always a lot of important information to know, you know, so we'll be sending you guys out all the information within a few weeks. So everybody have a great, healthy and wealthy month, and hopefully we'll see you guys in a month. And in the meantime, if you have any questions or any concerns with anything, you know, you know where to find us, kind of thing, you know. Okay.